Well, new tonight, state health officials sent out strong guidance regarding gender-affirming care in kids. Those guidelines met with swift pushback from LGBTQ advocates. And ABC Action News reporter Mary O'Connell is digging into the state's guidance, what advocates have to say, and how counselors work with children dealing with these feelings.
Today, the Florida Department of Health out with guidance regarding gender-affirming care for children. The state's top doctor said in a statement, quote, "Children experiencing gender dysphoria should be supported by family and seek counseling, not pushed into an irreversible decision before they reach 18.
Gender dysphoria is a diagnosis, and really what it speaks to is just the distress that an individual can feel if their gender identity does not match the gender they were assigned at birth.
While pushing back on information from the HHS, the department's guidelines are that social gender transition should not be a treatment option for children or adolescents, that anyone under 18 should not be prescribed puberty blockers or hormone therapy, that gender reassignment surgery should not be a treatment option for children or adolescents, and that they should be provided social support by peers and family and seek counseling from a licensed provider. I spoke to Abby Mayer, a nationally certified counselor who's worked with children who've dealt with gender dysphoria.
First and foremost, it's just letting them know that they're supported and that they have a safe place to talk through those things, and also empathizing with the fact that it can be really confusing.
Mayer explained there's a whole process that goes into getting children gender-affirming care.
If it's a child or adolescent, they have to be seen by a mental health professional, have rigorous assessments, they have to see an endocrinologist, they have a whole team of medical doctors.
It goes against the U.S. Department of Health and Human Services, and it's against the best practices from the American Medical Association.
Andrew Lent with Equality Florida tells me trans children are at a higher risk for anxiety, suicide, and depression, saying their position is this should be a choice between doctors, youth, and their families.
They just want to be loved. They want to be affirmed for who they are. And just like all of us, we have a right to competent care. Trans children should have a right to competent care and privacy and parental support.
In Tampa, Mary O'Connell, ABC Action News.